Rehab, it's Lauren and Arash here, and today we are answering your burning questions about viral health products, hot topics, and questionable supplements. You ready?
Let's do it.
Okay, question number one. Creatine.
Okay, this is a good one.
This is a good one.
Yeah. Lauren, what does creatine do?
Creatine. This is, if there is one hot topic right now, I feel like everyone is talking about creatine.
Totally.
I don't know where this came from. Okay, so what we know from the research is that creatine essentially increases the amount of something called phosphocreatine in our body, which is used to create something called ATP, which is the fuel of our cells. So more phosphocreatine, more ATP, more fuel for our cells, more energy. And so people are finding it super successful with high intensity workouts. From what I know, most systematic reviews and research out there is showing that it's most beneficial with high intensity type of workouts. But yeah, it gives you energy, it makes you feel stronger during workouts, and that's what we know about creatine.
Totally. So, can anyone take creatine?
Excellent question. So, like many things, it depends. Always, Arash and I are not nutritionists, and that is not within our scope of practice. So if you have questions about if creatine or any sort of supplement is right for you, always consult with your care team. Please do that. But creatine, in regards to creatine, started out being mostly weightlifters, power lifters, those Olympic lifters, those type of individuals. But now they're finding that it actually can be really successful for a lot of older individuals that are doing resistance training or even not doing resistance training, and they're still building muscle mass and strength, which is great because we know that's so important as individuals age, to stay strong, keep lifting, feel powerful.
Totally. I mean, it makes a lot of sense. Like, if the goal is for your patient to build strength and there's a lack of strength, or you're worried about strength from happening, let's say someone is post-op and there's a bunch of atrophy from happening, or someone's aging and they're at risk for sarcopenia, like age-related muscle loss, it makes a lot of sense that you can augment the results of whatever you're doing with creatine. With the stuff that you've looked at, are people typically training and using this as a way to supplement their training?
Yeah, and it should always be, as so many things are, it should be used as a tool, right? It is not, just like we talked about with BFR, it's not an end-all be-all. You shouldn't just do BFR training. That's not going to get you anywhere. So, yes, it should be used as a tool, but a lot of people are using it with resistance training too, to feel stronger. So, yeah, I think it's great. If you're interested in using it, definitely chat with your care team first and foremost. But if it helps, just as you touched on, older individuals, especially dealing with sarcopenia or balance-related issues, if it helps them feel stronger and want to get in the gym and resistance train, then I'm all for it.
Makes a lot of sense.
Yeah. Could one use BFR to overcome arthrogenic inhibition?
That's a great question. So arthrogenic inhibition is the lack of being able to activate and control a muscle after surgery, usually because of all the swelling, pain, and inflammation. So for example, let's say you got knee replacement or ACL surgery, that quad muscle is oftentimes inhibited. Now, something like blood flow restriction training is used as a way to target fast twitch muscle fibers, which help with producing strength in a way that you don't have to provide too much load to that tissue. So in general, I would say, yeah, it's a great tool to use, especially when you're post-op or when you're limited in terms of the ability to stress like a certain tissue like your knee because of protocols, or maybe you're just in pain. So I think generally in that situation, when you have some inhibition, it's a great way to further target that muscle.
Have you had a lot of success with it with patients?
Yeah, totally. Post-op is a great time to use it. I will say that early on when BFR really came out, people almost overutilized it in certain situations, which I think it's helpful to see, like, you learn something new, you overuse it, you see, okay, maybe it's not used for that patient population. And so I've seen it even with patients that are high level, but I think it's only used in that case for like maybe a deload week, not necessarily for like as a way to build up strength indefinitely. I think it's not a replacement for heavy training. It gets you similar results to heavy training. However, it's only for a temporary period of time.
Yeah, I think some people get kind of sidetracked thinking that they can use BFR for heavy training, and that's not what it's intended to do, right?
Yeah.
So have you found success with using it on lower extremity versus upper extremity, or one seems to be more beneficial than the other?
Yeah, I'd say I've used it for both. I just feel like there is much more use case for the lower body,
Yeah, I agree.
especially with all the surgery, post-surgical patients that we do
Mm-hmm.
see.
Mm-hmm.
So I would say it's more commonly used there, but I've definitely used it a lot on the upper extremity as well. And I've seen good results with that.
Yeah.
But totally agree. Once you can get back to heavy training or even plyometric movements, I've seen people do jumping and fast-paced motions with BFR. It's meant to be slow and controlled.
Yeah.
Like I usually recommend a 2-0-2-0 tempo, 2 seconds down, 2 seconds up, no hold at either position. So that way you can really metabolically strain the tissue.
Yeah. If people are doing it with more of that fast training plyometric, do you think it's doing anything at all?
I think that if anything, you're limiting the benefit from the plyometric training with no added benefit
Without
of
getting
the
anything
BFR,
else from it.
in my
That's a
opinion.
good point.
Yeah.
Okay, the other question I get asked a lot from patients is, can anyone do BFR, regardless of age or comorbidities or anything along those lines? Can anyone do it?
Yeah, I would say that most people can, but you definitely want to get screened for cardiovascular issues. I think a big one is looking at risk factor for clotting disorders like factor 5, where someone may not have the ability to clear their blood, because what you're doing is you're limiting the blood from flowing back to the heart and you're restricting some of the blood flowing to the tissue. So you create this hypoxic environment, meaning there's not much oxygen in that area. And because of that, you see the limb almost get blue and like the veins will really distend out. So that's how it works, but at the same time, if you have some of these risk factors, you want to get screened and make sure that you don't have a risk for having some of these issues from happening.
Don't go tie rubber bands on your arms, people.
Yeah,
Get screened first.
You want to be objective with it.
Please.
That's the very important piece with it, is making sure that you know exactly what % of the limb occlusion pressure you're actually utilizing versus arbitrarily cutting off circulation. That's not how you want to approach this.
Yeah, we don't want that. Yeah, we have a really good video on BFR training that you can check out if you're interested on what it actually looks like, the process, how to apply it, and the timing of everything. So
That's great.
our users want to know, do e-stim or muscle stimulators, do they actually work?
What we like to use is NMES, neuromuscular electrical stimulation, is a tool that you use by placing pads on like a certain muscle group to help with activation. Does it work? In short, I would say yes, it works. I would recommend people using it usually when they have a difficult time recruiting that muscle, and people can use it as a way to just voluntarily do it or involuntarily activate it. Like you see people put the pads sometimes on their abs as a way to just sit down and get a six pack. I don't really think that's doing much, especially if you're like a high level individual that can already go do crunches and all that kind of stuff. Like just do the exercise. But with individuals that have some type of neuromuscular limitation, whether they are post-op, like this arthrogenic inhibition term that we've used for the quad, for example, is a great time where neuromuscularly there's a limitation in being able to activate that tissue. So I think it's a great time to use it.
If people aren't dealing with, let's say, post-op type muscle inhibition, do you think there's any benefit to it?
I think if they have, let's say, overused upper trap, underutilized lower trap, I think, for example, maybe doing some soft tissue down regulation of the upper trap and then stimulating muscles like the lower trap could help find that muscle, but just temporarily in that situation. And then eventually, when someone feels good with finding that muscle, I think at that point you remove it.
Yeah.
But generally, for a healthy individual, I always try not to use it first. And if for some reason they're really having a difficult time finding it, then maybe use this as a tool to further.
I think another patient population that sees a lot of success from it too is individuals dealing with neurological sort of dysfunction, stroke, those type of individuals who, need a little bit of help with recruiting certain muscles to walk, to lift your ankle up into ankle dorsiflexion, to not trip. That's a population too that sees a lot of benefit from using those type of electrical stimulation tools.
I could totally see that. And then the other piece with that is you always want to try to voluntarily activate the muscles while using the electrical stimulation. It's a very helpful way to maximize the contraction versus if you're just letting the e-stim recruit maybe 50% of your muscle while you're just sitting there. So try to use the electrical stimulation as a way to enhance what you're already doing, not as a way to replace exercises.
Here's a good question. So there's recruiting the muscle for exercise. And then we also sometimes get the question too of, oh, could I put this e-stim on my back to help with low back pain? Or like, should I put this on my ankle after I sprain my ankle to help with pain? What are your thoughts surrounding that? And why do we do that sometimes?
Yeah. So I think that the idea of using stimulation as a way to manage pain is more diving into like TENS, which is a way of gating pain. Actually, what it does is it sends signals to the brain and distracts the original pain signals from being received. So that way you no longer feel those pain signals as much. And it works. It definitely works for a short period of time.
Yeah.
And that window may give you the opportunity to do the exercises that you need that you're limited with because of pain. So it does help with pain, but it's not solving any underlying issue. What do you think?
Yeah, so I mean, two different things, like Arash was saying. TENS is what we can do to essentially break that pain cycle. We're interrupting the pain cycle that is going from low back to our brain by providing the body with another stimulus that travels to the brain a little bit quicker than that pain does. So yes, definitely a short-term solution, but not an end-all solution to pain and discomfort, but can provide some short-term relief if that's when you need it.
Yeah.
Does telehealth PT work?
Okay, that's a great one. If I was to give the short answer, I would say it definitely can. I think physical therapy as a profession has evolved pretty significantly the last 20 years or so. I think a lot of the original treatment was very modality focused, ultrasound, ice, massage,
Lots of
like
manual.
and the thought was you have to be in person because this is the bulk of what we do. And then exercises might be there just as like an adjunct.
Yeah.
But it's flipped completely to where most of what actually helps fix the cause of certain issues is exercises. And then these other tools and modalities are used as a way to kind of mitigate pain or give, like the TENS example, give a window of time to do the exercises. So I think it's flipped a lot, and because of that, it's allowed people to be successful doing exercises and getting educated remotely. With exercise and education, I think those two pieces are the biggest thing. And I feel like, at least from my experience, the biggest reason why patients don't get better is adherence to the program. It doesn't matter if it's in person, if it's remote, if it's from a YouTube video. It's just a matter of making sure someone stays consistent with what they do.
Yeah.
What are your thoughts?
Yeah,
on
no, I agree. I think it is a good question. Thank you for whoever asked this. This is a great question. I think it really comes down, as you mentioned, Arash, to appropriate programming, right? Like, if you're doing the programming and it's appropriately done, then you will see the results that you want. But if you're not doing the programming, or the programming isn't well done, then you're not going to see the results that you want. And yes, early on, I think that PT was very much about hands-on and the ultrasounds and all of that. And yes, there's a time and place for that. We know that manual can serve a role in helping with pain and all of that jazz early on. But what's actually going to get to the root of the problem is exercise, appropriate prescription, and appropriate loading when you need it.
Yeah.
So can telehealth physical therapy work? Yes. But you also have to be willing to put in the time and effort to make it work.
Totally. The programming point you hit on, I think, is so important, and it's got to be adaptable based on the individual's needs.
Yeah.
And we can say this from firsthand experience with the app, because originally we made each program, like let's say you have back pain, it was very long. It was like 40, 45 minutes because we wanted to make the most evidence-based program possible. But we realized the best program that someone doesn't do is no longer a good program. And the key is to find what the minimal effective dose is to get someone out of that back issue in the first place. So we've condensed it significantly. A lot of them are like 20 to 30 minutes, and you can adjust them. You can progress or regress exercises accordingly because you need that adaptability. Not everyone is the same. Some movements may feel better for someone that has back pain versus another movement.
Yeah, and I think it's also too, as you touched on, the education, right? Are you getting the right education at the right time? Which also our app includes so much education that's in there, which is really, really important. You want to make sure you're getting your education from someone that you trust. So yeah, it's all about right information, right time, right programming, and are you going to do it?
Totally. Not to mention how difficult it's become to go through the healthcare system in order to get in-person physical therapy. I think that's why telehealth has become a great alternative option, or virtual services in general. So that way people can stay consistent on their own, especially if you're doing a lot of the similar exercises week over week and you're progressing every couple weeks. Like, to go into PT 2-3 times a week sometimes is a big amount of commitment for someone. So that's where a lot of these services have recently become popular.
Yeah, I mean, I do a lot of telehealth with my patients, and they have a lot of success. And a lot of my patients they're busy and they don't have time to come into a clinic and drive 20 minutes both ways and wait for me to snag them. So just being able to have the option to hop on their computer and us to work through a session together, I mean, great option for people who feel limited in time.
Totally.
Sure.
I think it's moving more and more this direction.
Yeah. Cross bracing protocol.
Okay.
What are your thoughts?
That's a great question. I actually recently tore my ACL, so I had to go through this thought process as well of, do I need surgery versus do I not need surgery? And the cross bracing protocol is essentially where you let the ACL heal on its own, which is kind of crazy because beforehand people thought that the ACL wouldn't really heal.
Even an option, yeah.
Exactly.
Yeah.
So you thought you'd be a coper, meaning that you don't even have an ACL. However, this cross bracing protocol is putting you into knee flexion at about 90 degrees. That's where the ACL is closest together, so the idea is it can heal. And it's kind of crazy to see, like 80 to 90% of people in some studies have shown that the ACL can fully heal back to its, at least, I don't know if it's original state entirely, but it does heal in terms of having an attachment again. So that part's cool to see. I think there is a lot of downside that is not talked about. At least I haven't seen much downside talked about with being in flexion for that long and all the atrophy and the stiffness that's created because of that. And you're slowly, after that 4-week period, based on the protocol you're following, you're going to slowly get back to extension. So it's going to take a lot of work. And it's kind of cool that you can allow the ACL to heal on its own. But for me, when I was thinking through that decision of should I go through this or not, there's just no long-term studies looking at that. And so that's, for me, what limited me from even trying that in the first place. And we've seen tons of patients that have gotten ACL reconstructions, and I wanted the path to be predictable. So that's why I opted in for an ACL reconstruction. But I think this idea is very cool, and I'm interested to see over the next few years how research kind of comes out here.
Yeah, I'm definitely interested to learn more. I haven't seen any patients who have had the cross bracing technique done, but in my PT mind, I'm like, okay, restoring extension, that is not going to be easy. After you have been braced at 90 degrees for 4 weeks, and we know how important extension is for quad function, quad strength, gait, running. I don't know. It's so interesting to me.
I know.
That's where my PT mind goes.
That's where my mind goes too.
what?
And there's a very large cost associated with being in flexion for that long.
Yeah.
And I believe in it like 24/7. That's why, like, for me, it's my right leg. So talk about the lack of being able to use my right leg for driving or basic things. Like, I can't do that. If it was my left leg, it would be a little bit different. But you have to stay stuck in that 90 degrees position for at least 4 weeks. And some people I've seen even say 6 weeks. So yeah, there's a high cost there. And you're hoping that the ACL heals, and hoping that healing is strong enough to allow you to do things as normal. Even in our ACL classes that we have here, there are many people that don't even have an ACL that are doing high level stuff, so it gives me the idea and hope that, like, these people can probably at some point get back. It's just a matter of, is that the ceiling that you want? I don't know what that ceiling looks like long term. So for me, it was too early to commit to a protocol like that. Should you ice after an injury?
This is a great question. This is a great question for many reasons. Ice can definitely serve a role immediately after an injury. And those acute phases, right? First 48 to 72 hours can serve a role in managing excessive swelling, definitely a role in managing pain. But we also know too that we want to allow the body to have a normal amount of swelling. That's actually really important for the healing process. And we don't want to be using ice to a point where we could be possibly hindering that important healing process that needs to happen with inflammation to the site. So I'm usually telling my patients, and again, this is so case specific, but I'm usually telling my patients that if you feel you need it for excessive swelling, put some ice on it. And then also, if you feel you need it to manage pain, so to serve as an analgesic, put some ice on it. But we generally want to try not to be using ice too much after it's truly an acute injury after those first few days. I don't know. What are your thoughts?
Yeah,
this is like
no,
a conversation that always pops up.
It's a tough one because there's a lot of different opinions on this. I agree. Like, I think that the first 72 hours at most, like that's where people can use it for preventing more swelling from happening. I think that a lot of ice in what we see in PT is just used for analgesic, and that's just a temporary period of time that gives you that feel-good feeling where the pain kind of numbs out. And it's kind of superficial too. It doesn't really get too deep, so just keep that in mind as well. But I think that the way that even I'm using it right now post-op is to prevent the swelling from happening. So for example, if I know I pushed it a little bit at doing my PT exercises, I know I'm probably going to swell. So let me just put the ice. It's going to vasoconstrict and limit the amount of blood flowing to that area for 20 minutes, and then I'm good. There's actually some theories that say that if you do ice for longer than 20 minutes, you can have the opposite, this rebound effect where you vasodilate and actually create more blood flow to the issue. So be mindful as well that more is not always better with these kinds of things. But I think that early on, especially after you had an injury or if you're trying to prevent a certain area from swelling further because of certain things that you've done, it's kind of like a micro trauma during that session, which is the same answer as early on. I think those are two great use cases for managing swelling and extra fluid, but I also agree that some fluid needs to be there, and you don't want to completely drain everything from it, which is why you don't see people completely draining their joints of blood or of fluid, because you need some of that in terms of the healing process.
Yeah, I think sometimes too, ice for some people can almost get them in this mindset as well of like, ice it, don't move it. And that's the last thing we want people to be doing. Ice, sure, for analgesic reasons and whatnot, but you really should be moving a body part through a pain-free range as soon as you can tolerate and per what's been cleared by your care team. But it shouldn't be just an ice and rest and don't move.
Totally.
You know what I'm saying? And I feel like sometimes people get into that mindset of, if I'm icing, I can't move it, and that's actually not the case. So
yeah, no, I agree with that. It just kind of like feels like it's kind of been coupled together. And the other piece is be wise when you're using it. Like, I think there are some patients that are worried about swelling that I've seen right before PT. They're icing it when, you know, that's not really the best time to use it. Actually, if anything, it's decreasing the neural signals to that tissue. So if we're going to be doing exercises, I'd prefer that you wait to do ice until afterwards, just to like calm things down, prevent secondary swelling from happening.
Yeah. Do posture correctors actually work?
That's a great question. We get that one quite a lot, and you see so much on social media that has to do with fixing your posture, these little, gadgets. And do they work is dependent on what you're using it for. I would say in general, people either go one side or the other. They say that it's never useful or they use it all the time. And I would say that if you ever want to use something like this, it's a crutch. Think of it as like training wheels to learn how to have better posture. So, okay, this is the position that I need to be in. Try it out, maybe use it for a couple hours throughout the day. Feel like this is the position that you should be in, open up the chest, etc. And then over time, you build up strength of those muscles. You allow for your own postural muscles to start working, and then you wean off of something like that in order to build yourself up, because you don't want to rely on something like that indefinitely. Ultimately, your body has the capacity to do the same thing that the posture corrector essentially does.
Yeah, it's definitely a tool, and I think people can get themselves in trouble if they're relying on it and wearing it for 8-10 hours a day.
Yeah.
Then you're not doing yourself any, service at all. I'm like, the rule of thumb is your best posture is always going to be your next posture, right?
Totally.
So move, lay on your stomach, stand up, slouch over, but just continue to move throughout the day, because our bodies are meant for movement and they are not meant for static positioning. So even if you think about having a posture corrector on for 8 hours, you're still putting your body in a static position for 8 hours and not allowing it to move in and out of different ranges.
I totally agree. I think to that point, it's more important for me and my patients to be even in poor posture with movement breaks over perfect posture all day with no breaks. So I would take that first over the second any day. And that just shows the power of just being able to move around, get blood flowing, etc. And this idea of perfect posture, I think, has become a little overpopularized and has allowed for a lot of business opportunities to come about because of it. And I've even seen certain athletes that practice with their posture braces because they think that it's going to get them ready for the game. But in my head, I'm like, well, now you're relying on this thing, and then when you're actually getting to the game, you don't have this device pulling you back into this position, and your game is going to be completely different. You're learning to play well with this brace. You're not learning to play well without the brace. So, and if you want to use it temporarily, again, that's one thing. So you got to keep that in mind. And if you're dealing with pain or something like that, I totally understand that might be something that's useful to get you past a certain hump. But once you're feeling better, the goal is to build your body back up.
Everything in moderation.
Yeah.
Poor posture in moderation. Great posture in moderation. Posture corrector in moderation, for sure.
Totally. Next question.
Yes.
What is dry needling and how does it work?
All right, dry needling. Dry needling.
Let's hear it.
Okay, so I dry needle, and I would say I dry needle probably 90% of my patients.
Oh, wow.
Yeah, I mean, it's a pretty high number. So this is what we know about dry needling, and research is still, I mean, there's so much research out there, but we also don't have a very clear understanding of what exactly it does. What we think it does, there's a few theories. The main one that's supported right now is we use an acupuncture needle. The needle goes in and it causes a small lesion to the muscle or the area, and it kind of restarts the healing process in that area. So it tricks your body into starting that acute inflammatory response again, which comes with all of the feel-good healing processes that we need to heal appropriately. So I've had a lot of success with it on patients who have been dealing with more chronic type stuff where that inflammatory process may not be as appropriate as as it should be, because it's just a great way to kind of like kickstart it and restart how our body thinks about that certain region.
Are there certain injuries that you feel like you've noticed more benefit compared to others?
Yeah, that's a great question. So I definitely have noticed low back pain for sure. I've had a lot of success with.
It helped me out.
Yeah.
Yeah.
That calf strains, chronic tendinopathy type stuff, just making sure we're addressing all the muscles. I mean, we know that tendons don't get a crazy amount of blood flow as compared to something like a muscle. So tendinopathies I've had a lot of success with, low back pains, calf type stuff, Achilles type stuff, plantar fasciitis had a lot of success with. So yeah, it's a great tool.
That's great. That 90% of your patients is pretty impressive.
I kid you not, it's probably 90%.
How long does that typically last?
I mean, just like any manual technique, it's a tool, right? It is a tool and it's not a solution. So we know that dry needling is the most beneficial when we couple it with appropriate programming and exercise. So I typically dry needle my patients for the first, 2 to 4 sessions. And then at that point, they're ready to just really dive into the exercise programming. But just like manual therapy, massage guns, dry needling, all of it is truly a tool, and you need to make sure you're doing the appropriate exercise programming to actually solve the underlying issue.
That makes a lot of sense.
Yeah. I'm going to ask you.
No. Don't ask me this
Arash
one.
doesn't want me to ask him this question because this is a tough one.
The question is red light therapy masks. What are they supposed to do?
What are they supposed to do? All right. Besides make you look like a Transformer or Darth Vader or something. Research on this is so new and preliminary that we really don't know a lot about red light masks. There is some very little research out there. What it's showing is that it obviously can increase cell activation, help with healing tissue times on the skin, and help with aging and that type of stuff. But
I see it all over social media. I don't know any of the
me
effectiveness.
Too. Yeah, but we know, I mean, you think of red light masks, right? And then you think of low light laser therapy that PTs use a lot within practice. And we know that that type of therapy can help with increasing cell processes and healing process. Totally. And there's definitely a role there. So are we saying that red light masks don't work? No, we just don't have enough information to.
Makes sense. Like, I think there's just going to be less money behind putting research to maybe some aesthetic purposes over solving musculoskeletal injuries.
Yeah, exactly. So, become a transformer or not? Should you foam roll or use a massage gun?
I think foam rolling and using a massage gun have a similar end goal of basically relaxing certain tissues. And one or the other. For me at least, a lot of it comes down to what tissue you're looking to kind of relax or put pressure on. And for example, like when I'm doing my back, it's hard for me to use a Theragun or massage gun. It's much easier to use a foam roller, and if I'm using that on my glutes, same idea. It's like it's a little difficult to get that much pressure. So I think both achieve a similar purpose in terms of what they do. Now, I think that question of like, should you use it or should you not use it, comes down to what your intent is. And I would say that it's actually useful for relaxing certain tissues. I think people think that it's a replacement for stretching, and that's where they go wrong. I think taking tissues through range of motion is a separate goal of relaxing tissue. Like we talked about electrical stimulation earlier. Think of this as the exact opposite of electrical stimulation. This is like calming down the muscles from a neurological standpoint, getting it to relax a little bit. Like, could it secondarily improve flexibility? I don't know. Like, I think you've looked at some things maybe on that.
Yeah. I mean, flexibility, yes and no. It definitely depends on the type of tissue. So I think people are always rolling out their IT bands, right? Can we actually cause a change in a fascia that's thick with foam roll? No. It takes tons of force to be able to change that length of that thick of fascia. So very dependent on the body part that you're rolling out or whatnot. But to Arash's point, it's really a great way to provide another stimulus to the body and provide almost a relaxation type of.
Yeah, and the other piece is the pain relief aspect of it from like an analgesic standpoint. And there's a couple different theories, but like I know that this idea of like, think about when you're listening to maybe a song in your car and you turn it all the way up and then you turn it back down to its original state. Oftentimes that loud noise kind of desensitizes you a little bit. So where you pull it back to its original state, it feels a lot better. So that's a theory. So you're not actually solving and fixing any underlying issue, but you're perceiving it as less threatening because you've kind of put a lot more pressure. That's one thing. The other piece of it is just relaxing that tissue itself. I know the thought of maybe having a hypertonic or tighter muscle can limit some blood flow and create a lower pain threshold. So that could also be possibly why certain tighter tissues are more sensitive.
Yeah, I think too, something that people find that they're doing more than they should is spending 8, 10, 12, 15 minutes on the foam roll. You really only need, research shows us it's like 60 to 90 seconds is really all you need to be spending on the foam roll. So you don't need to show up to the gym an hour before your workout to foam roll or spend an hour after the foam roll. All you need is like 60 to 90 seconds.
Totally. And that's the idea of more is not better. And actually what happens is if you think you need 10 minutes, you end up not being consistent with it because the barrier to entry is so high that you end up just skipping it. If you just do a little bit for certain tissues, then I think it's more likely that someone is going to stay consistent with something like that.
Yeah, for sure. Okay, I think we did it. I think we covered everyone's questions about trending topics.
That was good. That was a fun episode. A lot of different topics from post-op to performance to red light masks.
You got us all.
Covered it all.
Great questions. If you all have other topics or things that you want us to speak on in our YouTube videos, drop them below. And we'd love to speak on that. Maybe not red light masks though. I don't know.
Yeah, we'll try to do our best. Like there are some things that we're definitely more equipped to answer than others, and some things that don't have evidence to support, and any question and all questions are welcome. So appreciate you all for submitting these questions. Until next time. All right, this one's a hard one.
I've been dreading this one. This is my second most dreaded one next to creatine.
You crushed creatine though.
Did I?
Yeah.